So, welcome everyone to the latest installment in our every other week series on COVID-19, on vaccination, and with an extra emphasis today on return to campus. We just seem to have a huge turnout today, which is really great. Much appreciated. It occurred to me as I was thinking about this presentation that if this were a Netflix series, the kind of thing we all binge watch, there would be a little button down in the lower left corner of your screen that would allow you to click on it and skip the introduction. But we don't have that button yet. I understand the IT people are working on it, and we may soon have it. But for now, you've got to put up with my introduction. So Jerry Rosberg is my name. This event, if you've been with us before, you know has 3-star panelists. It has Donna Lin, the university COVID director. It has Melanie Burnitz, who is the senior vice president and head of Columbia Health. And it has our very own Wafa El-Sadr, university professor and head of our public health working group. We don't have Wafa for the moment. We're hoping she's going to dial in. Wafa is in Eswatini right now in the southeast corner of Africa. And she's participated in many other calls in the last few days at all hours of the day and night, her time. But we are hopeful that she'll join us before we get too much further. As part of this introduction, I wanted to show you this picture, which came from last Friday's commencement, in case you didn't get to see it. It's a great honor at commencement to carry the mace. And this year, the 3 leaders of our COVID response effort carried the mace together. It was just a wonderful moment to see it. And I just wanted to pay tribute to the 3 of them and let all of you see that. If you'll forgive me for one more moment, and if it sounds like I'm stalling because we don't have Wafa and I need to fill time, there's some truth to that. I wanted to say that many people have asked me, what is it like to be sharing this platform with these 3 giants, these 3 superstar leaders who know so much about public health? Actually, nobody has asked me that, but I keep expecting someone will. So I've thought a lot about the answer. And it puts me in mind of a long ago professional basketball player named Rod Hundley, known to all as Hot Rod Hundley. And Hot Rod used to say that the high point of his career was one night at Madison Square Garden against the Knicks when he and Elgin Baylor combined to score 73 points. And that of those 73 points, 71 of them were scored by Elgin Baylor. So that's how I feel here. Not one Elgin Baylor teammate, but 3 Elgin Baylor teammates, and my contribution is 2 points. But let me now turn it over, please, to Elgin Baylor number 1, Donna Lin, our very own COVID director.
Good afternoon, everybody, and we're hoping we can get Wafa online shortly. But the first thing that we're going to do, in addition to give Jerry an opportunity to take his act on Broadway in September, is we're going to do a quiz, which invites participation from all of you. We have a number of questions, both about return to campus as well as COVID and vaccines. We're going to do this briefly and then get into 2 presentations, one from Jerry, one from myself, and then we'll leave plenty of time for Q&A. Please feel free, some of you have done this already, to jump into the chat box with your questions, and we also have some emailed questions as well. So Robert, why don't we go right to the quiz? Great, let me come off mute. And the first question, we have a little bit of a split in terms of the vaccine mandate, which we announced last week. The correct answer to this question is false. We have mandated that the vaccine is required for all students, undergraduate and graduate. But we are still considering whether or not it will be mandated for others. I can point out to you that a number of universities, notably the California public system, have done this, but there's still some work that we want to consider and take under advisement. The next question. By New York State law, public and private employees are granted time off, overwhelming majority at 95%. Jerry, do you want to share with everybody what the time off actually is?
so that the time off is required by state law, and that if you need that to make sure you can get vaccinated, it's there for you. We want to do everything we can, and state law requires to enable you to get that vaccination. And can we say, Wafa, you missed our introduction, but welcome. We're so glad you made it. We have alerted everybody that you're calling in from Eswatini. We thought you were having technical difficulties, but thrilled to have you with us.
Thank you. And I was having technical difficulties. Thank you.
Well, not to mention that it's also quite late there. So thank you for joining us. Let's go to question number 3, and we're excited to see all the responses to this one because you got it right. We do require a substantial number of COVID-19 preventative measures on campus, including face covering, including 6-foot physical distancing, and a number of other things that we'll cover in the comments as we go forward. Okay, let's go to question number 4. And again, Jerry, I'm going to ask you to speak to this one. A Columbia employee who's been working virtually may determine their preference for work, either virtually or in person, for the fall term.
So the false is the correct answer to this question. The 77% have it right. This is a complicated and a sensitive point. We know that many of our employees have strong preferences on this, but we're going to get into this in more detail when we turn to the return to campus. It's ultimately not something that starts and ends with each individual's preference. It's something that your unit, whether that's a school or a department or other group within the university, has to figure out where do they need their people and what's the right way to deploy them. But much more to come on that later in this program.
Great, thank you. We'll turn to Wafa for question number 5. And there's some nuances to this one, so it's not surprising that the split is what it is. All offices and other workplace spaces need to be deep cleaned and disinfected every day. Wafa, the answer is? Mapo, you might be unmuted.
Yes.
Oh,
yes. Yes. I just wanted to clarify that actually the answer is false, and the reason is the critical word is disinfect. I think now the CDC has eased up on a lot of recommendations in terms of required cleaning and disinfecting, and particularly with acknowledgement that there's very little evidence that this virus is transmitted through contact. It is transmitted through largely through the respiratory tract, as you're all well aware. So I do think that we can ease on some of the deep cleaning and some of the disinfecting that has been ongoing. And essentially space after it's been 24 hours after it's been occupied by somebody who has been diagnosed with COVID-19, that space can then be just regularly cleaned and no need for the deep cleaning and disinfecting.
Great. So just to clarify, if someone has been diagnosed with COVID and worked in that workspace, there will be additional measures based on how close the time was, and in some cases, the space will be closed. So let's go to number 6. As of May 15th, offices will be permitted to increase capacity from 50 to 75% in accordance with COVID health and safety guidelines. And I'll turn to Melanie to respond to that one.
Thanks. So this is a slight trick question. So those who said true are actually right. As of May 15th, that is true. The guidance then changes on May 19th. This is based on new guidance that was just released yesterday to add to the confusion. So you may be reading about capacity limits being eliminated completely. That is true on May 19th. The one thing that will remain is the 6-foot social distancing within spaces. So while there may not be a cap on the capacity, the 6-foot will remain.
Great. And as you can tell, things change literally every day in this world. So and let's go to question number 7. Once vaccinated, I do not have to participate in testing or daily symptom check. We'll turn to Melanie again for this one.
Well done. The false is the right answer there. We continue to provide that additional layer of safety, requiring the initial gateway single COVID-19 PCR test for anyone returning to campus. So that might be some new faculty, staff, and students who are coming back for the summer term who have not had that testing, and the daily symptom self-check is still required for everyone. And with the testing as well, we still have requirements for certain groups of students living on campus, as well as our ongoing random sample for faculty, staff, and students. And that is required if you are selected regardless of your vaccination status, because it's really important for us to continue to evaluate the prevalence of COVID-19 on our campuses and to monitor the impacts of vaccination.
Great. And Melanie, one last one. We'll go to number 8. Can fully vaccinated people safely visit with other unvaccinated people from multiple households?
False. Well done again. So if the unvaccinated people come from multiple households, there's obviously a higher risk of transmission among them. So the safest place to visit is outdoors. But again, masking is definitely recommended in those situations. And certainly if the visits are taking place indoors, everyone should follow all precautions, including the well-fitting mask, staying 6 feet away, and visiting in a well-ventilated space. So I think the key piece in that is safety measures. There is the ability to visit with people if you are fully vaccinated, but it doesn't eliminate the need for all other safety measures. And again, outdoors, a safer environment than indoors.
Great. And Wafa, we'll turn to you for number 9 and number 10. Is 95% efficacy mean that 5% of people who get vaccinated will still get infected?
That's interesting because it seems like an even split here on this one, and the answer is false. When 95% efficacy when it's noted as vaccine efficacy, it means that in the vaccine arm, amongst those who received the vaccine, there were 95% fewer cases of COVID-19 that developed compared to those individuals who were in the placebo or control arm. So that's what you need to keep in mind. It's actually the difference in the percent difference between the occurrence of COVID-19 between the two arms of the study, the vaccine and the control arm.
Great. And then the last one, number 10, the majority is right on this one. But Wafa, if you would like to give a little explanation about what fully vaccinated people should still be concerned about.
I'm sorry?
The number 10 is fully vaccinated people should still be concerned about symptoms of COVID-19 if they're exposed to someone who has COVID-19 either suspected or confirmed.
Yes, I think we do know that people who've been fully vaccinated can still get infected, and therefore they should be monitored for symptoms and again be tested if they develop symptoms, even if they have been fully vaccinated.
Great. Okay, well, thank you all for your responses. We think it's a great way for people to think and learn a little bit about, as we said, the ever-changing landscape. Robert, if you would start the slides up, I'm going to do a short overview of where we are on COVID-19 and our vaccines, and then Jerry Rosberg will talk about return to campus. So you can go to the next slide. Keep going. As I do in every one, we try to give you a sense of what the hills and the valleys look like in terms of COVID. Of course, that post-December period was the scary one for the United States, which showed a tremendous increase in the number of cases, followed by a long drop, a little bit of a plateau, and happily we're on a drop again. So go to the next slide to show New York, which is a little different. I like mountains, so I like to say we've had actually 3 mountains in our New York State situation with a sharp decline recently, which partly explains a lot of the changes that Melanie mentioned that just have happened in the last few days after we put the quiz together. So the governor did make a pretty significant announcement yesterday. Go to the next slide. I like to show the zip code map partly because it just gives you a sense. The lighter, the better, and Manhattan has always consistently been lighter than the other boroughs, but we're lightening up in some of those places where we had some significant positive rates in Brooklyn and in Queens in particular. You can go to the next slide. And then we also track what happens here at CYMC in our own hospital environment. And you can also see a long period. I'm sorry, the dates look blurred on the bottom, but that peak of 200 cases actually happened on February 8th with a little bit of a decline, but at a very, very slow rate. But we're beginning now to see numbers again that look much more like pre-Christmas and pre-December holidays. You can go to the next slide. And then the testing program that Melanie and CUIMC collaborate on, it has showed some tremendous results throughout the period of time when we started testing, which was June 22nd. But this is our weekly number for last week, a positivity rate of 0.10, hugely significant when you think about the numbers, the percentages nationally. So great results in both our total testing and our random sample testing. Go to the next slide, thank you. So this, two important things to look at. There's a lot of data on this slide, but I want to draw your attention to the second sub-bullet for New York State. The positivity rate is now under 2%. Again, that hasn't happened since back in November. Excuse me, the cases are down overall, but we look at the 7-day average, but it's really important that this is dropping. And again, for New York City, we have dropped below 3%, the first bullet under New York City. And you may recall, if you participated in other forums or you're just tracking this information yourself, we were at 6-7% at certain times. But I think the key takeaway is how safe the campus is, because that 0.1 compares to the 2.78, although this is a 7-day average. You can go to the next slide. So we mentioned, and this is complicated, and I'm going to try to make it less complicated, that just a few days ago, the CDC changed their recommendations for people who are fully vaccinated. And I sort of bucketed it into a few categories. There's a nice picture we're going to show you that helps you remember this, which we'll ultimately put on our website. Actually, you can, so the first is, excuse me, oh, I'm sorry, go ahead, Robert, that's my fault. If you are immunocompromised in any way, you really need to speak to your doctor, even if you are fully vaccinated, and take into account all the normal precautions that you would do. I said to the group earlier, when in doubt, just keep your face covering on and you will be safe. But there are some permission that the CDC has given us, where fully vaccinated people in certain outdoor settings don't need to wear a mask, except when you're in a large crowd. That's kind of common sense. Our workers who, excuse me, are exposed, as long as they're asymptomatic, don't have to stay home from work. And there's also some loosening around non-healthcare settings regarding quarantine. You can go to the next slide. So this is the map that I'm going to show you that really distinguishes between, if you're vaccinated, there are many things that you can do. You can go to a restaurant, you can ride public transportation. It does still show, if you look closely, that the majority of activities, though, for fully vaccinated people still are safest if you are wearing a face covering. And we're going to say that over and over again, because despite all the loosening, we are going to keep seeing face coverings present on the campus. And then on the left side, for unvaccinated people, there's a few things that are now deemed to be safe. Some of the outdoor activities with members of your household and very small family gatherings. Otherwise, they are in the less safe and the least safe categories, and again, many common sense applications. You can go to the next slide. So I just want to share with you a couple things before we turn to Jerry on where we are in terms of the vaccine for our community. We are seeing in New York City right now the 3 vaccines that have emergency use authorization from the FDA, that's Pfizer, Moderna, and what's the J&J. We are getting, as we now as a university are providing the vaccine. We get a limited supply from a New York Presbyterian, our hospital partner, and the city. And as I said, face covering still required in almost all circumstances. We have vaccinated ourselves either at NYP or at Columbia facilities, over 13,500 of our affiliates. Many have gotten them in other locations. And an important thing too, related to your vaccine status, excuse me, irrespective of your vaccine status, is that travel quarantines and testing are no longer part of the equation. And of course, we went through many months where you couldn't travel internationally, and we had other restrictions here at Columbia as well as across the state. You can go to the next slide. So some quick data, which you may have seen, over 56% of the US population has had at least one dose, close to 41 has had 2 doses. You can go to the next slide. New York is performing a little less well than the entire country. And clearly there are pockets that no doubt you have read about where the numbers are much lower than the New York numbers, but we're getting close to 50% of New Yorkers having at least 1 dose. We did start in March a Columbia-run program that allows our faculty, staff, and students to go to Lerner Hall, which many of you are familiar with from the testing program, and to get vaccinated through an appointment system, or come to 168th Street and Columbia doctors' practices also at 103rd, 51st, and within the next couple of weeks in several Westchester locations. So we have vaccine supply, we have vaccine appointments, and are happy to vaccinate any of the participants on this call, and also family members. You can go to the next slide. This just gives you some of the data to show you that since we started this program, and we were participating in other programs with New York Presbyterian back in December, but since we started up in mid-March, we've done over 6,000 vaccinations for our faculty, staff, and students, as well as for patients. You can go to the next slide. And then I just want to touch briefly on the vaccine mandate, which we released a couple of weeks ago. It is for students, as I mentioned at the beginning of the program. And what we really want to encourage everyone to do, whether you're a student or your faculty or staff, is to get vaccinated now. Don't wait until the fall when the current mandate goes into effect. There is a process that you will be getting information on for religious and medical exemptions, excuse me. And of course, we have a lot of people who have received their vaccines internationally. So I will stop, turn it over to Jerry, and we'll hear a little bit about return to campus, and then we'll get into your questions.
So as Robert is putting up the slides here, I know there is tremendous interest in the answer to this return to campus question. And as indicated in the Q&A, a lot of the questions are very concrete, very specific. What does this mean for me? When will I be coming back? Under what conditions? What will it be like? You're going to see that as hard as we're trying here to be responsive, we still don't have crisp answers to a lot of the questions that you've got. So what I'm trying to do in the next couple of minutes is to tell you as much as we can so you know where we are now. And I want to give you some understanding of why we don't know more than that. Now, we seem to have lost the slides here, Robert. Can we try again? There we go. We're trying again. Okay, so if we can go to the next slide, I tried to boil this down to 3 questions. The first is when? When are we coming back? The second question is who? Who is coming back? Is everybody coming back? Will some stay remote? What does all that mean? And the third question, is it safe to come back? Now, there are 3 questions here. One of them is easy. The easy question is the third one. It is safe to come back. You've heard a lot of data that Melanie referred to, Donna referred to, about how safe it is on campus. You'll see that in the third question, I also made reference to commuting, because often when the question of safety comes up, people say to us, all right, we get that it's safe on campus, but how do I get there without putting my health at risk? I don't want to be on the subway. The fact is that Melanie, and I hope she'll address this before we're done today, there is data. There is data that indicates that commuting is safe. That's not where transmission is occurring. But for me, the most important thing you need to know is that in any given week, we have about 18,000 people who are coming onto our campus, and they're doing that safely. They're commuting to get there to do it. These are students, these are faculty, these are researchers, staff. This is everybody that we're talking about. And on campus, I don't mean College Walk or the steps in front of Low Library or Haven Square. I mean people who are swiping into our buildings. So it is safe. But what about those two hard questions? When are we coming back? And will it be everyone? So let's go to the next slide if we could. Okay, so I wanted to start with the goal because the goal is clear. We want, President Bollinger said, normal university life in September. And Ira, our provost, and Donna put out a statement on April 26th in which they provide further explanation of what President Bollinger meant, that planning is commenced for a full schedule of in-person academic instruction inside our classrooms with faculty, students, and the great majority of staff back on campus. So that's where we want to be in September. But what exactly does that mean? And how are we going to get from here to there? So let's go to the next slide. The first and most important point for you to understand here is that this is not a central university decision. It's not that we sitting in Low Library have come up with a plan and are unwilling or unable to communicate it to you. The reason why it's taking so long is that each school, each department, each unit needs to make its own plan on when people come back, on how they come back. That's where the critical decisions are being made. And it takes time. This is an elaborate planning process that each of our units is going through with a lot of consultation, a lot of discussion internally, and a lot of work. And it's taking time because it's important and we need to get it as right as we can. At the university level, we're going to establish a framework. But as I say, it really is up to your unit to answer this question for you. Next slide, if we could. All right, so what this is intended to show is a timeline that emphasizes 2 points, that it is a transition that we're talking about and a phased return. And I tried with this arrow to suggest that there are 3 different phases that we're going through. On the left is the period of time between now and September 2021, the end of August, during which time we have to get prepared for the fall. Most units are not going to bring everybody back on September 1. That would create a kind of chaotic reintroduction that would be too tough, too challenging for too many people. So what units are working on is how, during this period through the summer, to phase a return, to bring people back, to let them get used to being returned, even if it's just for a few days at a time, so they can get their feet on the ground and understand that it's safe. The next phase is the fall of 2021, but I deliberately wanted to show a third phase of 2022 and beyond to say that fall 2021 is not the end goal of this exercise. It should be thought of as basically a pilot program in which we're going to get it as right as we can for September through December, but what comes in 2022 and beyond is going to depend on what we learn and how do we adapt to what we learn. Okay, next slide if we could. Now, this is a slide that's got 5 circles here to illustrate a spectrum that runs from where many of you are now, which is 100% remote, to the far right where it's 100% in the office. And there's a point in the middle, which we're calling hybrid. And the point to the 2 other shoulder circles is to say, this is a spectrum. This doesn't need to be all or nothing. Hybrid can be pretty close to all office, or at the other end of the spectrum, it can be pretty close to all remote. But as your schools and units are thinking about this, it's with a chart like this in mind. They're trying to decide where do they come down for each individual group, each individual function within their group to make sure they're getting it right. So next slide. Okay, So this is a slide that talks about some of the considerations that the schools are going to look at as they decide where on that spectrum that I just showed, where do they want to set the slide. It's not likely to be one answer for the whole unit. It's going to vary by function. They're going with the units that are now engaged in this very intensive effort, as I said earlier, to look and see who needs to collaborate with whom. We have administrators, for example, who interact on a regular basis with faculty or researchers or students. Many of them interact with community groups on the outside. Those people may have different needs to be back, physically present, than people who don't have that kind of interactive function and who may be able to spend more time working remotely. Productivity is a consideration. So, and this is extremely important, is the effective use of our space. Columbia is an extremely space-constrained institution, as we all know. And if we can create a new work environment that uses space more effectively than we have in the past, we have the opportunity to create new space for collaboration, for innovation, for improving the employee experience. This is hard for the units to get this right because these questions are big and difficult. Finally, another consideration at the end is, how new is the employee? Is this somebody who's very familiar with Columbia and doesn't actually need a lot of interaction to learn our culture and our processes? Or is this somebody new who may need to spend more time on campus in order to learn about us? Next slide. The point of this slide is, this is about how long is this going to take, or put the other way around, how fast is this going to happen to me? And there are two key points here that schools are committed to. One is it's a phased approach. My assumption is that few, if any, units will bring all of their people back in one shot. They will bring them back in groups, probably starting on a part-time basis in order to get used to it. But the second point, and we've said this before in prior discussions in these town halls, we will make sure the schools are committed to giving you notice. We have committed to at least 3 weeks notice before you're asked to move, barring an emergency. But everybody understands you need more time than that if possible, and we will do our best to provide it. Next slide. Okay, so this is my last slide, and this is the one in which I've tried, with all of the qualifications that I've offered, that it's up to the schools and it'll depend on function. There are some propositions that have emerged from the planning exercise that's underway. And let me go through this carefully, because this is where I hope I can give you some, at least minimal guidance about what to expect. Point number one, all remote, a situation in which, as it's been for many people during COVID, you Monday through Friday, you're working at home remotely, never coming onto campus. I can't say there will be none of that in the new world, but that's not the norm. Indeed, I would say it will be unusual for someone to be 100% remote. What most of the units are planning on is either full-time back in the office or some kind of hybrid model. All right, so you ask, what does that mean, a hybrid model? So again, understanding these are not rules, individual situations will vary, but I hope this will give you a sense of where this is headed. Hybrid for most of the units with which we've been consulting about their planning means 2 or 3 days each week on campus. Now, that doesn't mean everybody will be, there will be many, many people who will be 5 days on campus, just as there were before. But for those working remotely, what you should anticipate is that it will be hybrid remote, which means a couple of days off, a couple of days on. Next point, which days will you be there? It can't be a random choice in which I decide today I feel like staying home, whereas tomorrow I'd like to be in the office. If the point of getting people back is to allow them to coordinate and interact, we need to know, when are your coworkers there with whom you need to coordinate? So I think what you're going to find is that for those of you who will continue to spend some time working remotely, that you will be told that Tuesdays and Thursdays are days when the whole team is here. because that's when we interact in person and want the benefits of working together. The final point on this slide is a variation on what I've already said, which is the expectation in all the units that we've heard from so far is that they will want essentially all of their employees to be within commuting distance of campus. That the situation in which you have a country place in Seattle or in Arizona and you're very comfortable there dialing in, that's not the norm in this new world going forward. I can't say that it will never happen, but the standards for whether it will happen are likely to look a lot like the standards that applied pre-COVID. Namely that if there's some special reason for you to be in Arizona and you can get all the approvals needed, it's possible that you will get them. But that's not what we mean by remote work. Remote work, for the most part, will mean hybrid, spending a couple of days at least each week on campus and some days off. So I admit this doesn't answer your questions, I'm sure. I just wind up with a plea for your patience to give your schools and units a chance to work through their planning effort. They should be consulting with you. I hope that's happening. They understand, everybody understands how important it is to our employees that we get this right and that we come up with principles that make sense for individuals as well as for the school. But be patient. They will get to you. And the likelihood is that when it is time for you to come back, it's going to happen gradually in a phased approach that will let you get used to it. So I pause there, Donna.
Great, thanks, Jerry. We have 83 questions in the chat box. Hopefully we've answered some, but I'm going to try to cluster them and start with Wafa because there are a number of questions about the booster. And when, what will that be like and will we be providing it at Columbia?
Yes, there's been a lot of interest in the development of boosters. And by that, I mean new forms of the vaccines that are available now that have a different kind of coverage, that they are developed to really protect against some of the new variants that did not exist at the time of the development of the initial vaccines. So several companies are already developing such new vaccines to be prepared potentially for the need to vaccinate people again sometime maybe in the fall. We're not 100% sure that that's going to be needed. A lot depends on what happens over the next several months in terms of the trajectory of this pandemic, as well as also the prevalence of different variants.
Great, thank you, Wafa. There are a lot of questions about 3 feet, 6 feet, or no distancing, and I'll take a crack at it and ask Melanie and Wafa to join in. So the governor's announcement yesterday, if you read it, spoke to reductions, eliminating reductions in capacity, meaning if the capacity of a space is 100, you can go to 100, but you still, in every case, including where there's vaccinated people, must maintain 6-foot distancing. That's a CDC rule. It's a New York State rule. The second part of some of the questions was, but why then are K through 12 classrooms in particular able to have a 3-foot distance? Again, that's a CDC rule. We are appealing both to the CDC and the state because it's going to make it more complicated and challenging, if not nearly impossible, to maintain 6-foot distancing in our classrooms in the fall. We're working on, variable schedules from Fridays to longer hours, but we're pretty optimistic given our mandate on vaccines that something short of 6 feet will be possible. Melanie, anything you want to add to that?
No, I think the important differentiation as well is what the governor's announcement yesterday speak to is settings outside of academic settings. So we don't yet have any guidance in the higher ed. As you said, we do have the guidance for K through 12, which has gone from the 6 feet to 3 feet. That guidance just hasn't yet been provided in higher ed. So we're awaiting that and then can do that classroom planning.
But
and the 3-foot,
sorry, Mark, go ahead, Rafa.
Yeah, and the 3-foot for the K through 12 is really based on data. There were a couple of studies that were done that showed that there was really no difference based on 3-foot versus 6-foot distancing in that particular specific scenario of these types of schools.
And our hope, because I know a number of you put into the Q&A, when will we know this? Our hope is that we know this within the next several weeks so that it does help us to plan effectively. Jerry, I'm going to toss one to you. And again, it's a cluster of questions. We mentioned the mandate for students. The question is, why are we not mandating vaccines for faculty and staff for the fall?
So the assumption underlying the question is incorrect. The assumption is that we're not mandating it for faculty and staff. And the truth is we just haven't made that decision yet. And there is a lot of work and a lot of consideration going on under that. And I don't want to predict myself where that's going to come out, but I would say that if you were trying to judge the momentum here and elsewhere is in the direction of a broader mandate, not a narrower one. So stay tuned, more to come on this subject.
Great. And then, Jerry, I'll follow up on that. Can a student who is taking an in-person class find out if their faculty member who's teaching the class has been vaccinated?
Well, I'm afraid I don't think we can do that. I don't think there is any way that we can do that consistent with the privacy rules. And you should also know that we get the opposite question, where a faculty member says, can I find out which students haven't done it? And we can't do that either. So ideally, we want people to be mandated and to be vaccinated. And the hope is that by the time we get there, most people will. I noticed, Donna, that in the chat, someone asked about the fraction that has 13,500 on top, and the denominator is our total number. But I think the misunderstanding there is many more than 13,500 of our people have been vaccinated. That's just the ones that we've done. The actual number could be twice that or more.
Right. Thanks, Jerry, for the clarification. Again, we're only operating in 4 locations, all in New York City. So anybody who, even in New York City, went to the Javits Center, went to some of the other city-run sites, or maybe even another hospital, we wouldn't have a count of that currently, nor do we have counts of people who went to the other counties in New York, New Jersey, Connecticut, Pennsylvania, et cetera. So thank you for picking that one up. We have a question about, is there a policy or process personnel should follow when engaging in person with external parties, for example, vendors, guest speakers, et cetera? Wafa, do you want to tackle that one?
This is in terms of the regular preventive measures that we have in place. Yes, all of them need to be observed. And even if there are vendors coming in, they also need to do a paper-based attestation as well. And of course, we have to observe the distancing, the masking, and all the other protective measures with anybody.
Great. And we do have on the COVID-19 website policies that were recently updated for academic visitors to campus that will give you the information around all of the guidelines around them. But any visitor who doesn't, for example, have the Reopen CU app has got to fill out a paper attestation form that they adhere to all of the conditions that those people who are on campus are adhering to, including distancing and masks. Melanie, a question for you. Currently, we're only allowed to undergo 1 COVID test per week at Columbia. Could that be increased to 2 tests per week?
So right now, that is correct. Those who are participating in the voluntary testing can voluntarily test at most once a week. And we do believe that is adequate given the numbers we are showing. Again, if you're symptomatic, you shouldn't be coming to us to get tested at a mass surveillance testing site. And with more and more vaccination, in fact, you could argue the opposite in terms of the testing, obviously outside of a random surveillance. So we are sticking for the summer with the once per week voluntary testing. And again, to emphasize, if you are symptomatic, you should certainly speak to your PCP about getting tested.
There are a few questions in the chat box about 12 to 15-year-olds. I'll answer that question. We do expect the CDC to act on authorizing Pfizer for 12 to 15-year-olds next week. One indication of that happening is that the state just asked us to order extra vaccine for anticipating the 12 to 15-year-olds. And we will be vaccinating 12 to 15-year-olds at the 3 current Columbia Doctors locations, so 103rd and Broadway, at 51st Street. Excuse me, sorry for that. And you, when you go online to schedule your appointment, you'll be given those options. Wapa, a question for you about how concerned do we need to be about exposing our even younger children when returning to in-person work? So children less than 12.
Yeah, I mean, I think we, again, as Jerry mentioned, as Donna mentioned, we have a very safe campus. And as was mentioned before as well, is that commuting has not been a risk factor for getting infected. And so long as people are doing their best to protect themselves and hopefully are getting vaccinated as well, there'd be minimal risk to themselves and also to their family members. So I think those are important things to keep in mind as well.
Great. Melanie and Jerry, I'm going to ask you to maybe tag team on this question. Are there going to be any work from home, even if it's temporary considerations for staff who cannot get vaccinated because of medical reasons? So Melanie, do you want to mention the exemption process, and then Jerry will turn to you on what that might look like from a work perspective.
Right. So right now, obviously, with the mandate only applies to students, but we obviously do acknowledge medical exemptions to vaccination. Now, for the COVID-19 vaccines, even if you've been exempted from other vaccines, such as MMR vaccine, for example, the one we commonly use in students, it's a different medical exemption because these are different kinds of vaccines. So every one of those is evaluated individually to determine if it's a valid medical exemption and then make recommendations in terms of what that person should do. Outside of that, right now, for faculty and staff, I would turn it over to Jerry for the HR consideration.
So the HR considerations are really identical to that. It's the critical point is that it's a case-by-case determination. And these are not new processes. We have a lot of experience with this, with exemptions and with accommodations. And your situation, if you have a special case, it will be looked at, and we will do what makes sense in relation to your circumstances. We don't want people to put their health at risk, nor do we want them to create a health hazard for others. So we'll deal with those on a case-by-case basis, but I don't anticipate there will be large numbers of them.
Great. I'm going to turn to Wapa. This is a vaccine question. Some people were vaccinated in December, January. Can they really feel like they are safe given that they'll be past the 6-month number relatively soon?
Yeah, I think that's an important question. And I think it's just to clarify, there's a misunderstanding. There was a release of some data based on the first 2 vaccines, the Pfizer-BioNTech and the Moderna vaccines, that showed that at 6 months after follow-up, that individuals were still protected and from getting COVID-19. Unfortunately, that was misinterpreted, meaning that it's only up to 6 months. That's not the case. It's just that the follow-up had been looked at 6 months because it hasn't been that long since these vaccines have been around. So we don't really know at this time the durability, how long the protection will be, but it certainly is likely to be beyond 6 months.
Great. There are a lot of questions in the chat box also about our commuter shuttles that we've established. They are continuing through the summer. They will be present during the fall. So you will see all of the commuter shuttles as an option to the subway. I'm going to also turn to Wapa on, excuse me, the CDC recommendations about fully vaccinated people who can stop wearing masks while outside on campus. Is that what we're going to allow at Columbia? That, for example, if you're walking down College Walk and you're vaccinated, you don't need to wear your mask?
Yes, I think we are going to be consistent with the CDC recommendations for somebody who's fully vaccinated and is outdoors. And please remember the word outdoors. And again, not with large numbers of individuals, that these individuals do not need to wear a mask according to the CDC. However, some people may still not feel comfortable enough to take off their masks. So it's likely that some people will continue to wear the mask. But nonetheless, we will follow the CDC guidance.
Melanie, could you address, let's say that hypothetically, you know that everybody in your department is vaccinated. Do you still need to wear a mask in the office?
Right, so that's the other side of the question Wafa just answered, and the answer is yes. We are maintaining the indoor mask mandate in all campus spaces right now. So the only, regardless of whether or not you know people are vaccinated, indoor spaces still require masks. It is just the lifting of the mask mandate in uncrowded outdoor spaces for fully vaccinated individuals.
Great. Jerry, we have a question about hybrid work. And is it possible that hybrid is the new norm, or is it just that we're going to have a transition period where hybrid is accepted?
So I think it's more than a transition period. In other words, I don't think this is just a phase that we're going through and a year from now it will be as if nothing happened here. We've learned a tremendous amount from this pandemic, and there are some functions that are just better done virtually than they are in person. I find myself that the time I save by not having to go from office to office for in-person meetings makes a huge difference in the available time that I have during the day. So I think a lot of this will continue. And what we're trying to do is to find the right balance and then to modulate it over time as we learn. But I don't think it's going to go away. At the same time, I don't think it's true that we're all going to be working in a hybrid way. It really is going to depend on what you do and what is possible given your responsibilities.
Great, Jerry, we're going to keep up with you because there are a lot of return to campus questions. This one is, if someone moved to another state during this COVID time and their work can continue to be done fully remotely, are they subject to termination if they do not want to move back to New York City?
So that, again, that's the kind of thing that can't be answered in the abstract. One has to know the circumstances, and it requires a conversation with your supervisor, with the people with whom you work. We've always had some people who worked far away from Columbia. So it's not as if there will be none of that going forward, but it's not a new norm that we're heading to, in which people are living all over the country. That creates legal problems for us. It creates practical problems. What many units have found is that even for people working remotely, the unit may feel that they need, without much advance warning, to say, we need an all hands meeting tomorrow. We need everybody here tomorrow. And they want to know that even the people working remotely can make that meeting. So this isn't intended to be punitive. Nobody is looking to fire anybody. We're just trying to optimize this for the university and to take account of what our employees need.
Thanks, Jerry. Melanie, I'm going to turn to you. We have a testing question. And the concern is, or the question is that can people get tested at non-Columbia locations? Because the concern is that it takes 24 to 48 hours to get our results.
So it really depends on the reason for why you're testing. If you're part of our required random surveillance or gateway testing because you haven't been on campus, we need you to be tested in our system. There's several reasons for that. It's access to the results. It's also the strength of the test, the sensitivity and specificity of the test that we're using. If you're just getting tested for your own personal reasons, certainly you're free to get tested at any site. But if it is for one of our required tests, it does have to be at our site. And results are usually available within that 24 to 48 hour window.
Great, thank you. I just want to get to a couple more questions and then we need to wrap up, but please be assured we see all the questions even when the program ends. We have the questions and it's clear from the volume of questions that there's some Q&As and some probably more direct communication that we need to get out to all of you, and we will do that. But the question I want to answer, Wafa, to take a stab at is, we briefly touched on international students when I was discussing the vaccine mandate. And we have a number of questions about vaccines that individuals have received in other countries, and will they be accepted when that person or persons come back to campus?
Yes, we have thought about this very carefully, and the intention is, and this is consistent with the CDC guidance as well, is to accept any WHO qualified or WHO approved vaccine. So there's a website, the WHO has a website on all the vaccines that they have reviewed, and they indicate which ones have been approved and which ones are in the process of being reviewed. So please keep an eye on that website.
Great. And as I said, we have some homework to do as I keep looking at all the questions, but thank you for your input, and we will take into account some of the questions that you still have. A reminder that this will be posted online on the COVID-19 website. And Robert, do we have a survey as well today?
No, we do not.
Okay. All right. Well, thank you for your participation. We will be back in 2 weeks with a similar format, and again, informed by your questions. So thanks everybody for joining us.
Thank you.